steadily progressing. So let's focus on that in delivery. So all that we're going to roll around and look at the different aspects of what that means, delivering health outcomes through climate, through using climate action to deliver health outcomes. We're going to do it today through two panels. I will, let's see, click on. Yeah, let's go back. There we go. We're going to have two panels. So we're going to spend the first half hour or so talking to people who are from that health perspective. Very much health people doing work that is climate action also. So we're and then so that's the first half hour. We'll then look at actually it's not just about SDG 13 or SDG 3 or 2 delivery or 3 delivery. It's about how we deliver the health. Sorry, SDG 13, the climate one, or SDG 3, the health one. It's actually the way we will deliver these outcomes for health, for climate change, or through intersecting SDGs. So through food and nutrition, SDG 2, or transport, looking at urban issues, SDG 11, or how we deliver our energy systems, SDG 7. So this is really about intersections of the SDG delivery in the coming years, and how we emphasize climate and health outcomes as we deliver the different SDGs. So panel one is very focused on health actors and how they work in the climate space and all these other sectors. The second panel is on these sectors. So we'll explore in particular food systems and transport systems. We might also touch on energy systems as well in that. And then in the last half hour, we will come to the audience. So please, throughout the presentations, please do put questions you have for the panelists into the chat box. And in the last half hour, we will come to some of your questions, and they will be put to all 7 panelists. So we'll put all the questions from the floor in one section. So what I would like to do is introduce our first panel today, and we'll move on just straight into that space. And what I'm going to do is I'm going to be posing the questions in the first hour, asking each of our panelists to address the issues that they're most close to. And we'll do a bit of an exploration of each of the panels before we come to your own questions. So it will be hopefully a good and active discussion. So on the first panel, we have Dermot Campbell-Ledram. He is head of the Climate Change and Health Programme at WHO headquarters. He played a key role in developing the first quantitative estimates of the overall health impacts of climate change. He's also a lead author on the IPCC reports, that's the Intergovernmental Panel on Climate Change reports, and was an author of the first health report to the UN climate negotiations. We also have Omnia El Orani. She's from the International Federation of Medical Student Associations, representing medical students around the world. Omnia is a final year medical student in Egypt, but she's spent the last 6 years working on global health and student advocacy. She's got particular interest in planetary health, climate change, and non-communicable diseases. We have Purnima Prabhakaran from the Public Health Foundation India. She's a trained physician. She's Deputy Director of the Centre for Environmental Health at Public Health Foundation India, where she's leading the team working in environmental health issues spanning air pollution, climate change, water, and children's environmental health. And fourth on our panel, we have Julia Rehi from the Red Cross Red Crescent Climate Centre. She's director of that centre, and she's leading the centre's work on urban areas, which includes a focus on extreme weather. Julie is also senior advisor to American Red Cross and a visiting researcher at the University of Trinity. So I'm going to open up with a question to Dermot, and quite a broad question to Dermot, just a scene setter for us, please. Why should health be a critical part of the climate change agenda? Make sense of that for us, please.
Thanks very much, Alison, and thanks for the invitation to speak to this really important event. And what I think is arguably the most important question facing the world at the moment is how do we come out of the COVID pandemic in a way, as the title says, in a way that's good for people and for the planet. And I think that the first part of my answer as to why it's so important that health needs to be involved in this is because of the complete interlinkages between those two aspects, between the health of people and the planet. I'll sort of give the answer in three parts as to why health is so important to be included in these discussions. The first is how we talk about this recovery, what is said about the recovery from COVID-19. And health evidence absolutely has to be at the heart of it. As I think anybody who works in this field knows, there is absolutely no way to maintain health out into the future without maintaining a stable climate system. We're seeing from around the world at the moment, we're seeing heat records being set. We know heat kills people. We're seeing massive floods. We know they kill people. We're seeing wildfires. We know that they kill people. And all of this alongside the longer term, more gradual impacts, such as sea level rise, which will wipe out some small island states, impacts on food and nutrition, all of which will undermine the environmental determinants of health, which is basically all we have. I mean, these are the ultimate determinants of health. So that's part of the reason, part of what we need to put on the table. The other is that we also know that the decisions we take that are driving climate change are also having a massive detrimental impact on health. The most obvious of these is through air pollution. We know that somewhere around 2/3 of outdoor air pollution is caused by fossil fuels, and we know that basically polluting energy sources inside the home also are often linked, often partly drivers of global warming as well. And we also know that air pollution is a massive burden on health at the moment. So every minute, about 13 people around the world die from air pollution. There's about 7 million people a year die from air pollution. And in contrast to the way that some people are approaching the climate crisis, we can't offset those. We can't say, well, we'll save some lives over here to make up for lives lost elsewhere. Once those lives are gone, they're gone. We can't say it'll be cheaper to save those lives in the future. Once those lives are gone, they're gone. So we need to take the decisions we need to take now to save people's lives because it's the right thing to do, and it's also good for the climate. And we also know that our recovery, our climate response is way off track. We know that although the world has started to move, there has been some very encouraging signals, particularly recently. We are still a long way off the kinds of cuts we need if we're to stay below 1.5 degrees centigrade or even 2 degrees centigrade. And to link this to the COVID recovery, many of you may have seen a report that was published, I think, in the last 24 hours or so, on basically where that recovery money has been going in the major economies across the world. And about twice as much of the COVID recovery money has gone into actions which will increase carbon emissions compared to those which will decrease carbon emissions. Now, we can make excuses and say, well, we're doing the urgent stuff, we'll get onto the longer term stuff later. But every decision that is taken about propping up a polluting energy industry basically locks in emissions that are just going to be harder to get out of the system further down the line. So that's the first part, and I'll be quick about the next two, but that's the first part. It matters what we say, and health is important in what we say. It's also important how it's said as well, and everything I've just said now has effectively been negative. And it's really important for us to put the positive framing on this, because not only is it the right and encouraging thing to do, the evidence shows, the trials, the focus groups and the behavioral evidence shows that a positive framing of what we will get from acting on climate change is the framing which is most likely to stimulate action, to encourage people to act, to stop them either denying or falling into despair, and also to cut across political boundaries. And health is a really important part of that positive framing, because we know if we meet the Paris targets, the number of lives we save just from air pollution alone, if you're into putting economic valuations on things, if you put an economic valuation on those, they're twice as much as it costs the world to meet the Paris agreements. So we get more back in health just from meeting Paris agreements than it costs us to do it. And that's only considering one aspect. The evidence is starting to emerge that we may even get bigger health gains from from sustainable diets, from better urban planning, from more sustainable transport systems, and so on. So that positive framing is really important, and we know that at the global level, but we're also starting to see it at the local level as well. We see cities like Milan or Paris, which have partly in response to COVID have put into place more sustainable transport systems. These have in fact been enormously successful and popular. So we know that a positive framing works. And then the final of my three reasons why health is so important. So it matters what is said, it matters how it's said, but it also matters who says it. And we know that some of the, and I hesitate to say this in a political forum, but some of the least trusted people in the world are politicians. They're unfortunately down there with their estate agents, journalists, and so on. Some of the most trusted people in the world, scientists are very high up there, weather forecasters are really high up there. But right at the top of the list, we see health professionals. We see doctors, and in many polls above them, nurses, as the most trusted professions in the world. So we really think that the engagement of the broad public health community in making this positive argument for why our climate response and our COVID recovery response has to be good for people on the planet has got to be the most important, the most effective way to take this forward. So that's why we're so encouraged by the mobilization of health civil society with the evidence and with their voices behind it to make these positive arguments. So I'll stop there and be happy to engage in the discussion later.
We'll certainly come back to you. I think that's a great setup for my question to Omnia now. And that is, how can health professionals and the health sector be part of the response to climate change?
Yes, thank you for your question. And I'd really like to echo what Darmot has said in terms of who are responsible for advocating for the health importance and interlinkages with climate change. I have very few slides to share in terms of what as a health sector and what us as medical students are doing. So I'll be very brief. As health students, we are the future health workforce. And as Darmot said, we would also be the first line responders to the impacts of climate change, as well as building the awareness and the resilience of our communities to the impacts of climate change, but also to taking climate action. That is why as a health sector, and as health students, we first of all looked at our education and then we looked at our workplace. We believe that it's important as medical students for us to understand what are the links between climate change and what we see on a daily basis in our own clinical practice when we think about asthma, heat stress, and all the different impacts that are due to climate change. We saw that only 15% of medical schools around the world had a mention of climate change. And this really empowered us to work together with several organizations like the Association for Medical Education to come up with a consensus statement to advocate for integrating climate change in our education, not just across medical curriculum, but across health curricula worldwide. So that future doctors, nurses, and the health workforce and the broader health workforce learn about climate change in their practice, but also in their advocacy within their own communities. And at the same time, we also tried from our aspect to compensate and to do our own initiatives to build awareness of both students and communities. We held diverse international workshops on climate change in terms of how to organize activities related to climate change on a grassroots level, but also how to advocate in global meetings like the HLPF, like the UNFCCC, COP, and so on. And we had the opportunity to invite global health experts who are with us today to give our students the experience and learn how to advocate for climate change and health. We also had the opportunity to design the first food for health and nutrition course for medical students to learn about climate change and its interlinkages with our food systems and nutrition. At the same time, our efforts on a global level has really driven diverse grassroots efforts led by students. And these are just a few examples of what our students are doing for climate change in collaboration with the health sector in their own countries. In Rwanda, students held a series of campaigns in their universities to advocate for safe and sustainable management of water and sanitation and hygiene services because of the impact it has on the outbreak of very common infectious diseases such as cholera. On the other hand, in Australia and Canada, students organized competitions for them to come up up with sustainable and environment-friendly solutions for their hospitals and their healthcare facilities to reduce their carbon footprint. Finally, in the UK, the students held a nationwide campaign to sign a letter aimed at the UK government and the COP26 unit in order to promote human health and place it at the heart of the climate change negotiations that are coming up in November. So finally, and as we are now in a virtual setting, but our advocacy when it comes to external meetings is really significant. In the last climate change conference, we did a survey where we assessed whether the delegates of the conference understood the link between health and climate change and saw how health was related to the climate negotiations. This survey was done 10 years ago by the COP16 IFMC delegation, and we saw that over the 10 years, there was a statistically significant increase in the delegates and their understanding of how health is really important to the climate negotiations and discussions. We also had the chance to ask them about the role of dietary change. Many of them were unfamiliar and only 36% knew what a planetary health diet was. However, most of them were willing to transform and take action when it comes to changing their diets. These are just a few examples of what us as health students and what the broader health sector can do. And I'm looking forward to your questions.
Thank you, Omnia. It was really encouraging to know that there's a movement really calling for the doctors and the medics of the future to be ready for the climate change which is coming and for responding to it in such a positive way. So thanks very much for that. I'm going to bring Purnima in now and look very specifically at an example from India. We've heard that the recovery is hopefully we come out of the COVID pandemic, countries are looking to recover, and they can do that in a way that's climate damaging and health damaging, or they can do it in a positive way, which has win-wins for climate and health. So Purnima, I wonder if you can give us, if you can, what are some of the key actions needed to ensure that the recovery in India can deliver those win-wins for health and climate?
Thank you, Alison. Greetings to all the participants joining from around the world and to my co-panelists here today. It's a delight to be following on from Dr. Diarmaid Campbell and Omnia, and who've already so beautifully articulated and set the context for this discussion. And about linking the need for health in the climate agenda, as well as the role of health sector specifically, as well as the health sector, the professionals in bringing health into climate policies. It's no news to most of this audience here today that climate change was articulated to be the biggest public health challenge of the 21st century, but also that it provides us the biggest opportunity, the biggest public health opportunity to address this crisis that is on us. And I think that was true a few years ago, and that statement rings true more than ever today. And I think it was not just about 18 months ago when we were together in the last COP, which Omnia just mentioned. And it was a small delegation of health delegates, and we came away from there with a firm resolve to mobilize all our resources to bring health at the center of all discourses in the next COP 2020. Of course, that did not happen. And, with the COVID-19 pandemic that kind of decimated all the countries across the world, I think we had a new priority on our hands. But to your question, Alice, on what are the challenges and the opportunities in the post-pandemic world to address not just future pandemics, but also this other existential threat of climate change. India, for example, is a country, it's a young and growing economy, 1.3 billion population. We did not do too well on our health indicators, even in the pre-pandemic era, with just about 1.3% of our GDP invested in health. So we were just kind of starting to sensitize the right stakeholders about the need to bring, climate change and the health linkages into the center of all programs and policies when the pandemic hit us. But I must say that, we are closer to the truth now that we need to bring the health lens into all of our work in the climate change arena. And I think we have huge lessons to learn from the pandemic. In that, I think we recognize now that, investments in public health, preparedness, enhancing our adaptive capacities is really important. And it's really important even to address the climate change crisis. And I think we can do that in a very unique way, starting with the health sector, recognizing this is such a resource intensive sector. It's a critical piece of any country's landscape. And if we can start with the health sector, that draws on every other sector. We need energy, we need water, we need transport, we need a whole lot of resources, manufacturing of drugs and pharmaceuticals, and all of that has a carbon footprint. So if we can start, when we are talking about our economic stimulus packages for the post-pandemic world, if we can start by working with the right stakeholders in bringing a health lens to all of those policies. And I can just start with this one example of the energy sector. We are still a very fossil fuel dependent economy, and fossil fuel emissions are a well-known culprit, not just for the air pollution crisis that we find ourselves in India, but also as a very strong climate pollutant. So if we move the demand away from a fossil fuel dependent health sector and adopt, the renewable energies, for instance, and we are blessed in India to be a sun-blessed country, tropical region with huge resources for transitioning to solar energy, for instance. We also have, the options of wind and hydroelectric power, but, just transitioning away to a cleaner form of energy, renewable, solar energy, we have a huge win over there. And I think that's where we need to start, move away from fossil fuel subsidies, move to adopting cleaner fuels. And that is just one example. I think we have examples in the way we eat, the way we commute, patients as well as the caregivers in India. I think we can move away to more cleaner forms of transport, sustainable forms of transport. And I think that's where we can start. And I think in India, we have great examples of some programs of policies that have started addressing some of these areas. And we only need to up the momentum over there. I'll stop there for now, Alison, but happy to take more questions in that space.
Thank you very much. And I think that there's huge challenges there, but I think with people like yourself, and I'm sure there are many more people pushing for the positive right policies in India, the recovery will be much, much stronger. So now we move to the impacts. Climate change is having impact right now. We've seen that with the heat waves across North America and in many parts of the world. So I'd like to bring Julie in now. And Julie, how do health systems need to be ready? How do they need to prepare to respond to extreme climate events that we've been seeing in recent years and will only increase in the time to come? So how can the health system be ready? How should health workers be integrated into those response measures when those events happen?
Yeah, great. Thank you so much. And thank you as well to you and to all the distinguished colleagues here for today's panel, which is a really interesting and already wide variety of perspectives, which is great. So I think the overarching key message is that health systems really need to be ready for the increased frequency, intensity, and volatility of climate extremes that we face already today, such as the heat event in the Pacific Northwest and Western Canada recently, but in general as well into the future. And heat-related extremes are a particularly good example of, or particularly acute example of this. And so a couple of ways in which I think health systems need to be prepared, and I'll describe that through that heat lens. It's critical that health systems are able to anticipate and absorb the increased demand for emergency health services when climate-related influences strike, such as extreme heat. So for example, being able to couple forecasts with decision-making to ensure either increased staffing or emergency health services during extreme heat events would be one example of this, but really tying that forecasting to those immediate needs that are about to come within days. Systems also being able to expand to better reach the most vulnerable in really large numbers very quickly, right? So during a heat event, I think most of us know on this call, one of the key things to do for health and safety is to check in on those who are most vulnerable, those who are older, those who might be isolated, pre-existing medical conditions, et cetera. So, but the key thing is to reach people quickly because that event is in that moment happening, right? And so even looking at ways that general practitioners, pharmacists, community health workers can be activated with key messaging that's tailored towards public awareness raising and shifting people's risk perceptions will be key. And some of this happens already, but also in ensuring that we're able to do this in an even larger way. and being able to adapt to the changing needs. And I think the COVID pandemic was an excellent example of this, where you had the confluence of safety messaging for the COVID pandemic was in some ways the opposite of many of the safety messaging for heat. And so there was a large effort at that time to try and figure out, well, how do we bring these two types of guidance together to be able to provide the best available guidance? And so that's a great example of being adaptable. And then, of course, from a heat perspective, there's also just the physical infrastructure itself, being able to take whatever long-term future actions we can to reduce temperatures of from even like a building orientation or building construction perspective, internal layouts, external shadings, et cetera. Those are a couple of heat examples, but I think there's also just some of these overarching themes that are broader than heat as well. And so a couple of priorities from the Red Cross perspective. One is that we need to ensure people in communities, especially in the most vulnerable situations, are at the center of efforts to advance universal health coverage and climate action. And we know that inequality exacerbates individual and community vulnerability to extreme weather events and climate-related health impacts. And so we have to ensure that our health systems as we recover are built to serve everyone. And data can be a key part of this as well. Data on access and utilization being collected, disaggregated, combined with local knowledge, and then being used to make decisions making looking forward. The second of third would be the need to expand and deepen partnerships between health system actors and local organizations such as the Red Cross, Red Crescent. Local partners being present in communities before, during, and after disasters are really well suited to understand and meet context-specific needs. And this is the case not only on the health side, but also on the climate and weather extremes perspective. And local partners, community health works can extend the reach of health systems by being able to prioritize underserved communities. And for example, the way I described for heat, but that applies across a number of other types of weather and climate risks, and making sure that that sort of last mile is really first in climate responsive health systems. And then the last point is really ensuring, as we come out of the COVID pandemic, that health systems are really adequately funded to be able to meet ongoing and emergency health needs. That includes these issues like having preparedness mechanisms in place, similar to what I mentioned for heat, but also things like robust mental health and psychosocial support services, as well as extreme weather events can have an impact on mental health and psychological well-being of individuals and communities. And that's it. Thank you.
Thank you, Julie. That's a real contradiction we have there, that in some ways the pandemic has got us ready and prepared and alert. On the other hand, the financial side is maybe more challenging coming out that other side. So that's a sort of counter challenge. So it's getting that money to the right places and learning from the pandemic. That's really, really interesting. I'm going to give a follow-up question, and I'm going to maybe a bit more specific. And that is really what in the next couple of years, really quite in the short term, what are the first sort of early actions to get health systems and the health systems integrated into the climate response? I'm going to come to Dermot first, because I know WHO have got strong initiatives that they're working on to get governments activated and interested and engaged on this issue. So what are the short-term actions to get us on that path for a health and climate system that's working together? Dermot.
Yeah, thanks. I think at the top level, I do think we need this understanding that the recovery from COVID does have to be a green recovery, because I think you're right to focus a little bit, Alison, on the short term. We know that climate change is a long-term challenge, but the things we do now, particularly in the COVID recovery, will have such long-lasting effects because there is such big fundamental decisions with so much money attached to them. We know that investment has to go in to prop up economies, to protect health systems, and so on. But this is, in fact, these are decisions that need to be taken over the coming months, maybe a year, at most, not longer than that. So, one of the things we've done from the WHO side is to publish a manifesto for a healthy and green recovery from COVID-19. We've also worked with partners in health civil society to to support them in writing to the G20 nations to make exactly the same case, that we have to invest in things which are both good for health and good for the planet. And so that does mean, protecting health systems. It does mean in the really short term, it means getting better, greater supplies of COVID vaccines and more equitably distributed. But it also means these decisions in other sectors have to be taken with a health and a planetary perspective in mind. It sounds like a big thing, but it is unfortunately an immediate thing as well. One other thing is that on the climate change side, we do think that it's critically important that governments start to fully integrate health and people into their climate commitments, into their nationally determined contributions, and into their other plans as well. Organizations, including some represented on this call, have last week launched basically a scorecard of the coverage of health in NDCs. This is coordinated through the Global Climate and Health Alliance, which highlights some really good examples of where countries such as Costa Rica, Argentina, to a certain extent, others have included health within their climate commitments. They've highlighted these health co-benefits that will come, and also talked about the investments that need to go in to protect people's health from climate change. And there is no reason why every country shouldn't do this, because pretty much everything, we know that this is popular with the general population. We know that the evidence is there. We know that it helps to stimulate climate action. We don't really see a downside for why countries should not put health quite prominently within their climate change plans. And we'll get another shot at this, but the next shot on the NDCs will be 5 years down the line. So again, it's really important that we do this now. And at WHO, yes, we're providing some direct technical support to some countries to do the analysis to show how big these health co-benefits will be if they take strong climate commitments, and to include those in the NDCs.
There's really positive things countries can be doing right now just to make sure it's built in from the beginning. That's great. Omnia, what about health professionals and health and medical students as they come out to become doctors? What would you like to see happening in that space right now?
Yes, I think now more than ever with the pandemic, we have the opportunity to increase the awareness around the links between health and climate change because we believe as students, our responsibility doesn't just lie towards our patients, but it lies towards our own communities, whom their health now depends on the health of the environment. We're seeing countries taking action for COVID-19 that was urgent, and this means they can do the same for the climate crisis. Now is the time for us to hold them accountable for the decisions that they are making, because we are the generation that will be impacted most by the decisions. And this is the future health system that we are going to live in and work in. And at the same time, we need countries to not just take the decisions for us, to work with us and collaborate with us. During this meeting, our IFMSA delegation is advocating for meaningful engagement of young voices of health professionals in the policies that are led. And this also includes the responses that are being developed by countries for climate change. So we are also advocating for countries to co-create solutions with us, work with us, and this presents an opportunity for further escalation of health in the conversation around climate change. We also have the opportunity to do that by collaborating with non-health youth organizations. And we, since the beginning of the pandemic, had the opportunity and were invited many times by many young organizations to increase and talk to them about how is human health linked with climate change. And COVID gave us the opportunity to do more of that. So my answer would be to build awareness, to be persistent, and to advocate within the global policymaking space for health to be at the center of the climate change discussions.
Fantastic. Just get that message out there and raise your voice. I think that's fantastic. Purnima, if you were to talk to the government or the state government, what would you like to happen at that, in India right now in the short term?
Thanks, Alison. Oh, well, I think, like I said, we are fortunate in India that, there's already some level of awareness, and we do have within our Ministry of Health a committed national program on climate change and human health. And that program is concerned with developing a national level framework for action that will then become decentralized at the state level. So every state then takes on this framework and mobilizes its health systems across all levels of healthcare. In India, we have a very diverse health system. We have the private health system. We also have the public health system. So different levels of healthcare, different kinds of ownership. So it's not an easy task, but I think we've already started on that pathway. And, just by increasing the awareness of the health system in India about the impending crisis that climate change is going to cause, not just in terms of the increasing disease burden, we've got to make our health professionals, our health actors, sensitive about that as well. The impending disease burden, we got to prepare ourselves for that, to deal with that burden, but also in that effort to see that we are delivering health in a very sustainable way. Our healthcare delivery has to work through several pathways, I think, whether it's through the actual delivery of care and services within the facility, but also in our supply chains. I think we can build the demand for sustainable products, for drugs and pharmaceuticals that are manufactured in sustainable operating facilities. And I think at the end of the life cycle, the way we dispose of all our healthcare waste, I think it's the entire life cycle of operations. And we have a huge role to play there in increasing the awareness, not just with the doctors, but every other actor that's involved. Healthcare is not just about the health-centric focus, but there's the players in the other sectors, the transport, the energy, as well as the water and the public works department. And of course, the nurses. I think we have, Omnia has given us all the examples of the medical students, the future health professionals, but we also have a huge task to sensitize the current professionals. We don't have it in our medical curriculum. So I think we need to start there, like, bring health, the climate change discourse into all our trainings as well. So I think there's a huge role for us as the public health professionals to make that change happen.
It's interesting. It's great that things are starting to happen, but it sounds as though that voice, that message has to really embed in the health professionals. And I think your point about the chain, it's not just about the point you get your medical attention, it's actually about the whole chain of supplier that sits around it that has to work well. And Julie, that's particularly important when you're in a disaster or an emergency situation. And I know that often in the climate negotiations, adaptation and that sort of response is often seen as a secondary level of importance. But so what can we do to make sure that the health responses within the adaptation sector are raised to the top and in many ways elevate that agenda of adaptation?
Yeah, that's a great question. I think, I'll go back to this heat wave that happened, a week and a half ago, 2 weeks ago at this point. The reason that event is in some ways unique is just how intense it was. So it broke temperature records by 5 degrees centigrade for that location or for that area. And that's really unheard of. Usually temperature records are broken by tenths of degrees, not 5 degrees. And so, we're part of a consortium that looks at events like this on occasion to look at what was the influence of climate change. Is there anything we can say about how its return time is changing, its intensity is changing, whatever. And that event was basically impossible in a world without climate change, and now is certainly much more frequent. But it also made us really stop and wonder, do we really understand just how much climate change is impacting heat waves because of this 5-degree temperature break, right? And so 2 answers here. One is that I think events like this, and recognizing that we're already facing not only extreme weather events that are influenced by climate change today that are deadly and don't need to be deadly, and therefore this needs to be elevated for that alone. But also that some of them may be happening faster than we thought. But then I think there's also an important element that is a different space than the policy space, and that's at a community level and a risk communication perspective. How do we we need to ensure that we're extending that risk communication and that people are sort of internalizing the risk that they face, which is a big challenge with heat as well. And that can happen, through potentially better community engagement, more research to better understand how to really communicate about these risks. But I think that's also critical. These need to go hand in hand, basically, alongside the policy conversations.
Thank you. I love how you bring that back to that localized response and readiness. I think that's a really important part that's often forgotten. So I'm going to wrap up this panel now. Thank you very much to our 4 speakers. We'll come back to you a little later in the event when we have our Q&A session with the floor. So thank you all very much. I'm sure we would be clapping at this point if we all could come online. So if you can turn off your screens and we can bring up our next panel, I will just give me 1 second as well. Share screen. Okay, so we move on to our next panel. As I said earlier, this time we're going to often there's a health response to in association with with climate change, but actually to get the health and climate outcomes, we often need to act through some of the other sectors. So for example, in our event now, we're going to start looking at the food systems and the responses needed there to benefit health and climate change, and the transport sector. Our speakers are going to focus on those 2 areas. So our panel this time, we have Lujena Kotnani. She has a background in global health and medicine. She's a doctor herself, and she's director of the Director for Global Action at EAT, which is a science-based global platform for food systems transformation. We also have Alice Yu. She's from SLOCAT, the Sustainable Transport and Mobility Partnership. Alice is a policy analyst with a passion for sustainable low carbon mobility and a specialist in strategic communications and knowledge management. And we have Carly Gilbert-Patrick. She's team leader for active mobility at UNEP. Carly has been working in the field of sustainable mobility for almost 15 years. She manages the UNEP team on active mobility, digitalization, and mode integration. So that's our second panel. And as before, I will be asking questions and I'll kick off with Lujene. So Lujene, how does what we eat impact climate change, and how can changing our diets improve health and climate change together?
Well, good day, everyone, and thank you for your kind invitation. It's a pleasure to be with you here today. Answering your question, Alison, our current food systems, and that includes from production to consumption, do not only affect our health and well-being, accounting for 8 million premature global deaths, but also killing our planets, affecting land, water and oceans, biodiversity, climate and air quality. In fact, up to 37% of total greenhouse gas emissions and 80% of freshwater consumption are attributable to food systems from agriculture, storage, transport, processing, retail, consumption, and food loss and waste. And if we consider food waste as a country, it will be the 3rd biggest greenhouse gas emitter worldwide. In addition, the conversion of natural ecosystems to cropland and pastures to respond to the global food demand is the largest factor causing species to be threatened with extinction. Overuse and misuse of nitrogen and phosphorus in food production causes eutrophication and dead zones in lakes and coastal zones. Environmental burden from food system include also marine systems, like 60% of world fish stocks are fully fished, more than 30% overfished, and catch by global marine fisheries has been declining since 1996. But despite those unsustainable food production practices, hunger and undernutrition including waste and stunting, still persist, while around 2 billion adults and around 40 million children are either overweight or obese. So food has become the biggest driver of environmental degradation and global health burden. And at the same time, the victim of climate change impacts, especially in relation to increasing temperatures, droughts, and poor soil. But at the same time, it is also our biggest opportunity to restore our planet and save lives by deciding better what food to produce, how much we consume, and how much we lose and waste. So transitioning to a food system that can provide negative emissions, and by negative emissions, I mean function as a major carbon sink instead of a major carbon source, and protecting carbon sinks in natural ecosystems are both required to reach that goal. So such measures include shifting diets. So shifting diets is the single most effective, fastest, and the most cost-efficient measure to reduce radically the 1/4 of all emissions accounted for by land use and food. At the same time, is a key catalyst to necessary changes further down the value chain. Several organizations, including Intergovernmental Panel on Climate Change, Food and Agriculture Organization, World Health Organization, UN Environment Program, and many, many others, all emphasize on the need to transition to healthy and sustainable diet to protect lives, protect people, sustain livelihoods, and restore our planet. The Eat Lancet Commission that was launched a couple of years ago presented the first ever scientific assessment of how to feed our growing population healthy food within planetary boundaries. And it suggested what we call the planetary health diet as one of the 3 main approaches to feed around 9 billion people healthy diets without destroying the planet by 2050. So at the global level, we need to have meat and sugar and double up what is better for us and better for the planet, like fruits, vegetables, nuts, legumes, and sustainably sourced seafood. And of course, this is not a one solution that fits all, but has to be altered based on the geographical diversity, culture, and cuisine. So for the West, for example, it means moving away from meat-heavy, greasy, nutrient-poor food. And for low and middle income countries, it means moving away from their deadly fast-track transition towards the West and leapfrog towards a diversity of nutrient and local ingredients. So finally, I would like to emphasize that a revolutionary change in food system to support human health and environmental sustainability is not only essential for securing healthy foods for future generations, but also to achieve the Paris Agreement and Sustainable Development Goals. Happy to answer any follow-up questions.
Thank you, Julie. I've been exploring this area with the Health and Climate Network recently, and it's very new to me, and I'm just so taken by how diet action can help climate and help can reduce obesity, it can improve nutrition. It's just really such an important action, and we can such positive methods about healthy food that we can get out there. It's not all doom and gloom about diets, it's about positives. So thank you very much for that. So we're going to shift subject here and just sort of explore another area, which that is transport and mobility. So I'm going to move to Alice now. And how can the way we travel be transformed to help both climate and health?
Thank you so much, Alison, for your question and also the invitation to speak in this event today. It's truly a pleasure to hear from our speakers exploring different health issues across different angles. And so to answer your question, and I'll be drawing from a very recent flagship report that we have released on transport and climate change, because this is a report that we explore how transport stands when it comes to decarbonization and tackling climate change. But at the same time, we look at various cross-cutting issues, including health, access and opportunities, gender, COVID-19 impacts on mobility, etc. And among lots of findings, we found some unsettling truths, as always, that the transport sector was the fastest growing fossil fuel combustion sector worldwide from 2010 to 2019, with sectoral emissions rising more than 17% during this period of time. So transport was the second highest emitting sector in 2019. And the way that societies organize systems of transport and mobility has a decisive impact on public health. For example, transport affects health by contributing to air and noise pollution, by impacting people's physical activities, such as walking and cycling, even including walking to public transport, and also through road injuries and deaths. And most of the top 10 causes of deaths worldwide are directly and strongly linked to risk factors, such as air pollution and physical inactivity, that are influenced by how transport systems are shaped. And these include heart attacks, which is the #1 cause of death, stroke, pneumonia, chronic respiratory diseases, lung cancers, diabetes, as well as road injuries, which is the #10 deadliest cause. Transport can also shape our exposure to viruses causing influenza and COVID-19, which evidently is being shown that is heavily impacted by the global pandemics. But then on the other hand, climate actions can yield large immediate public health benefits while reducing rising greenhouse emissions from the transport sector. And that is because many of the pathways to reduce CO2 emission are closely linked to policies supporting sustainable mobility, better land use planning. And all these things are both known to be good for human health and equity. And a large share of these benefits do come from walking, cycling, and public transport. For example, if an average person cycle just 1 trip per day more and drive 1 trip per day less for 200 days a year, it would not only improve the person's health substantially, but also decrease the mobility-related life cycle greenhouse gas emissions by about ½ a ton over a year. And that is a very important share of average per capita CO2 emission from the transport sector. And so within the transport sector, we often refer to a policy framework called the Avoid, Shift, and Improve framework to help policymakers to understand the need for a balanced, comprehensive package of transport measures to achieve an ideal system. So we want to have avoid measures, which helps to avoid motorized passenger trips and freight movements through urban and regional development policies, integrated transport and spatial planning, and a better travel demand management. We will have shift policies that help to shift passenger and freight travel to more environmentally friendly modes, such as walking and cycling, and clean public and freight transport modes. And we also want to improve the energy efficiency of all transport modes through low carbon fuels and vehicle technologies. And a study conducted actually by WHO, it shows that in Accra, Ghana, with a very progressive policy scenario incorporating avoid, shift, improve measures, by 2050 could yield a net health gain of nearly 40,000 deaths averted, while reducing greenhouse gas emissions by nearly 160 million tons in the transport sector. So these are just a few examples of the potential health impacts of transport-related health climate actions, and advancing these programs really do require coordinated efforts across sectors, including the health community, the transport and the energy sectors, and also across all levels of governments from local, national to the global context. So I'm going to stop here for now and hand it back to Alison, and happy to take any questions afterwards.
Great, that's a great setup for Carly. Carly, you're in Kenya. And I wonder if you can give us some examples of what we've been hearing, some examples from the African context of where action to improve active mobility can benefit road safety, air quality, health impacts, and what are the sort of key factors in getting that right? Carly.
Thanks. Yeah, very nicely set up for me. Thanks very much, Alice. So I think just to give a bit of context, you know, in Africa, on the one hand, almost everyone is walking and cycling. So it's about 70 to 90% modal share for active mobility, depending on the city context. So really modal share that would make other regions of the world jealous. But at the same time, historically, there's been a real lack of investment in the needs of pedestrians and cyclists. So the situation, generally speaking, is that that massive modal share is captive mode. So as soon as someone is able to, they will buy a motorbike or buy a car, or at the very minimum, start taking a motorbike taxi or a motor vehicle taxi. And that's why we see this kind of huge impact with like massive road fatalities, and the vehicle fleet is, you know, expected to triple in the Africa context by 2050. So one of our programs, Share the Road, very much is about working with African governments to put in place national and city policies to do things a bit differently and prioritize the needs of pedestrians and cyclists. And Africa is our priority region. And I think the global pandemic has really shone a light on how important having a transport system is that's integrated and robust. And we are seeing a bit of a momentum, if you like, through the pandemic and as we continue. So we did some research, and 90% of African governments who responded said they recognize the need to do more for active mobility. We're seeing a lot of, where we've supported policies, we're now seeing a lot of investment in infrastructure in places like Nairobi and Addis and Kigali. In Lagos, we're starting to see infrastructure. They're also doing a kind of regulatory mapping because they want to strengthen all the regulations in Lagos state around active mobility. So we're definitely seeing momentum where there wasn't such a big momentum before. I think what's really critical, though, it's at the moment, there's still neighborhood examples, maybe city examples. And what we're trying to work and support countries with now is scaling that up. So it's not just one city, but it's, you know, whether you're in Abuja or Lagos in Nigeria, you can expect the same consistency in safe infrastructure. And really the key things that we're seeing that are needed and have been successful so far is, one, budget. There is transport money in Africa. Because governments are spending their national domestic budget on transport, but generally speaking, it's still being spent on highways and flyovers. So it's about reassigning that budget so there's more of a balance on investing for the majority, which is pedestrians and cyclists. And then the other key thing is really getting the donors aligned, so you've got multilateral development banks, again, investing millions in big bus rapid transit projects, electric mobility projects, and that's fantastic. But if 70, 80% are walking, then I feel there's a real responsibility there to make sure that there are some requirements on those loans. And you're seeing that example on a city by city basis, but there aren't necessarily any guiding principles across the banks. Where there's success, we're also seeing really strong civil society and citizen voices advocating for what they need. And finally, I think leadership. So quite often in Nairobi, for example, we worked for many years, and it was only really with a change of leadership in the last sort of year and a half that we've seen the policy be implemented. Same with Ethiopia, the national transport minister is really pushing the agenda. So budget, donor funding, civil society, and strong leadership are what we see as the kind of melting pot of things that are needed where things are going well. Thank you.
Great, thank you very much. Yeah, that's really interesting. You're not necessarily asking for new money, it's about existing money being well directed, and I think that's absolutely brilliant. I just want to say, I'm going to give a follow-up question to our speakers. I do apologize, I may have to take a door call. This is the home working of the current in a second, so I apologize if I have to speak to someone. So if you can please get your questions into the box for any of our panelists. We're going to come back to the last 15-20 minutes to the whole panel, so please do get your questions in ready there for that. But I do want to follow up with our three panelists here. So as we emerge from the pandemic, we're going through the recovery. We've got a short-term opportunity to really get our sectors on the right path for health and for climate. So again, it's that question of short term. So I'm going to come to Lou Jane for the first, and then the other panelists. What are the sort of very short-term measures you'd like to see happen?
Yeah, thanks, Alison. That's a very interesting question. Due to the COVID pandemic, several stakeholders and decision makers are starting to understand the importance of food systems resilience, especially in front of the disasters and pandemics. So as several governments are wrapping up their efforts for post-COVID recovery, it's quite crucial that strengthening food systems resilience is a part of that. In addition, and just building what Julie has previously mentioned, we're currently and more frequently seeing the impacts of climate change, especially with the broken temperature records in several parts of the world, which actually emphasize our message for the urgent and radical need for climate action. And the top of that should include the food system transformation. First, in relation to the role of not just governments, but also private sectors, civil societies, and consumers in relation to dietary shifts, focusing on the interventions for healthy food environment and shifting demand toward more healthy and sustainable food options. And then second, adopt sustainable food production practices, and that includes the strengthening and the capacity building and the role of the food producers, including the small scale farmers. And then the third, using the target measure act approach to reduce the amount of the food loss and waste. But a more wider approach, an umbrella of all of that, is actually cross-sectoral collaborations and partnerships, breaking the silos across health, climate, agriculture, education, and others at a national, local, and global levels to ramp up our climate actions and to integrate that through ambitious nationally determined contribution and national adaptation plans, not just towards COP this year, but also towards 2030.
Thank you. And it's just, again, it's that different layers of the global to national to the very localized response, I think, coming through in a number of these presentations. Alice, the same question to you from the mobility side. What are those short-term responses?
I think it's important to note that actually we do see a very significant and temporal drop in emissions in the transport sector because of COVID-19. It drops nearly 20% below the 2019 levels. But that is only roughly equal to the reductions needed for the transport sector annually to reach the Paris Agreement targets. So we could see how dramatic or how transformational that it's actually needed, to actions to take place in the sector. And of course, walking and cycling has always, has been proven to be the most resilient form of transport modes during the pandemic. And at the same time, so in addition to that, I would say enforcing safety measures in public transit to regain that trust and also to nudge the less carbon intensive behaviors, persuading policymakers to understand that recovery packages, the money needs to go to public sector, public transport needs to go to walking and cycling instead of going to the carbon intensive transport modes. Another thing is that there are a lot of temporary measures that are being taken, like in Bogota, they do pop-up bicycle lanes in the first month of the pandemic. And it's important that policymakers understand that these can be turned into permanent measures. And I think a very quick thought that comes to my mind, and also that linkages between mental health and transport, because we often talk about how difficult it is during the pandemic to be locked in a place and denied access to things and places that you want to go. So imagine people that live in such conditions for most of their lives because of their physical or economic situations, the elderly, the poor, the disabled, the women, the children, and the youth who often don't have access to private vehicles or even bicycles. So we need to change the way that we design and curate social interactions in neighborhoods. We need to better plan public transport systems. And we also need paratransit services. They're informal services that caters the needs of those who don't have convenient access to public transport. We need to involve members of these vulnerable groups in the consultation, designing and the planning of transport services and infrastructure. So I think by doing that, we'll be able to turn that crisis into opportunities and actually creating a more people-centered, equitable and healthy system.
Thank you, Alice. And again, another theme there is it's not asking for new money or new things, you know, something that is inconceivable. It's about making the right decisions right now, actually facing the choices and making the right choices with the resources available. And I think that's a really strong lesson coming out of here. Carly, what would you get, you know, in countries in Africa to do right now?
So I think the first thing two things. So one, I'd like to echo what Lujan said, is to just start talking to more people, so cross-agency working. And I think, you know, we often say how difficult it is getting agencies to work together, you know, transport, health, air quality, climate, etc. But I think one thing COVID has showed us that when we really need to, we can. And I think the transport and health professionals working together in Africa to kind of use transport to, for example, distribute vaccines or to lock down certain areas because of the health impact, you know, really showed that if we need to, we can work together. So I think whatever level you work at, whether it's neighborhood or city or country or regional, just widen your group of friends, just start inviting more people outside of your comfort zone into the discussion. And I think the second one, which is a bit of an awkward one, because you said a short-term action and my response is a long-term, put down a long-term vision. And I think quite often, you know, with active mobility, there tends to be this kind of feeling that it's really straightforward. Oh, it's just walking and cycling. But actually, you still need your strategic planning, your operational planning, your pipeline of investment. And quite often it's easy to jump in with pilots and street urbanism, and all those things are great, but it doesn't really work long term unless you also have a bit of a vision on what you want for your city around walking and cycling, and those specialized plans and targets, and also not looking at walking as standalone, but how that links in with your paratransit and your public transport. What are the needs of the vulnerable groups? It's not one size fits all, and it has to be done on a kind of case by case, city by city. So I think a first step, a short-term step, is actually using that momentum from COVID, but using it to then develop a kind of long-term vision for your city or neighborhood or country. Thanks.
Thank you, Carly. And I think that's another thing, something we really wanted to get across in this this side event, was that it's getting us out of our silos. It's about making those new friends so that you can have that added win-win outcome for your sector, but for climate and health. And I think that's a really important lesson as well. During this section, sort of looking at these different sectors, there's another sector that I've certainly worked in a lot of my life, which is the energy sector. And I think the air pollution issue from, you know, as we're dealing with climate, we're also looking at other pollutants, and air pollution is one of those. So I wanted to bring Permina in again from the first panel, if I may, because I know you've worked on air pollution from energy systems a lot, particularly in the Indian context. So air pollution from cooking and coal and transport, as we've discussed, is a critical health issue that cuts across the SDGs. Can you describe examples where this is beginning to be addressed in India, please, Purnima?
Yeah, thank you, Alison. I think that is a question for India, because I think we have unfortunately, the dubious distinction of being the air pollution capital of the world, being designated to host, I think, 15 of the 20 most polluted cities in the world. So certainly there was action necessary and imperative. I think at least in the last 5 to 10 years, we recognize that we certainly need to set our home right. And I think in terms of air pollution, I think it's important also to draw the links here to the climate change issue, because many times the drivers of both air pollution and climate change, they're often common sources. And so there's co-benefits for addressing these two environmental risks together. And in terms of the air pollution issue in India, we have both the ambient air pollution as well as the household air pollution issue. We have morbidity and mortality from both of these issues. And the reason being that a good part of the country, the rural households are still using unclean cooking fuels, biomass for cooking, for heating. And I think that's a big area for intervention. And thankfully for us, I think there was a national program that was launched in 2016, actually, to kind of reach the most vulnerable households, the households that are below the poverty line, and reach them with this intervention of providing them an option of clean cooking fuels. And the important thing in that program was that the beneficiary was the woman of the household, given that much of the cooking happens by the woman of the household, and the vulnerable populations around her. The children are often sitting around with her when she's using these unclean cooking fuels. So there was a provision to provide a cleaner cooking fuel option in the form of an LPG cylinder, the gas. And though there has been good penetration in big parts of the country, they actually reached their target of about 1 million households. But the problems have been in the implementation and uptake and sustaining that program. And the reasons are many, because I think it's also about the behavior change that is important. People are so used to using that the biomass fuels, and they also talk about it being tastier. The food is tastier when they cook it on those chulas, So I think it's about a role for the health professionals again in changing the messaging, about the health impacts of using those unclean cooking fuels. I think we have a role there. So that's about the program that we have for the household air pollution. But in terms of also the ambient pollutants, again, the biggest culprit is the coal-fired thermal power plants, the fossil fuel combustion. And I think we did, in our nationally determined contributions that Diarmaid was mentioning before, India in its first NDCs in 2016 did commit to enhancing our energy mix that we will draw from renewable energies to about 40% by 2030. So I think there is political will, there is the intention, and we've done well by actually reaching at least 20% now. We have enhanced our solar power in the energy mix that we draw from. But again, India at a city level, if you get down to the city level, the sources of air pollution are very different. It differs from city to city. Most times it's travel, it's vehicular pollution, but it's also construction and demolition dust. It could be stubble burning from agricultural produce, So it has to be a very decentralized action at the city level, depending on the sources. And I think reducing our, enhancing adherence to emission norms by the power plants is important, but also in terms of transferring, making those transitions to sustainable forms of transport. We have a program also for faster adoption and manufacture of electric vehicles. So incentivizing people who are adopting electrical vehicles, making it more feasible, enhancing adoption of pooled transport, and making public transport more feasible and easier. Apart from, I wish I could show pictures like that from India about the walking and the cycling. We are doing it as a public health messaging. It is important to adopt more sustainable forms of transport, which includes, of course, walking and cycling, but you need to provide that infrastructure as well for people to adopt those healthier modes of transport. And again, I think the role of messaging, the health messaging about the importance of all of this from a health-centric lens, I think is important.
Thank you, Purnima. And I'm just intrigued. Again, we've got those connectivities. I asked you to talk on energy, but you talked about food and cooking, and you talked about transport, and you talked about urban issues. It just shows the interconnectedness of responses that we're needing to have that win-win outcome. So I would ask the panel, all of the panelists, if you can put your videos on. We currently only have one question in the box. Please come and put your questions. You've heard a lot there, and I'm sure there's a lot to explore. If not, I'll continue asking questions. We've got about 15 minutes left. But the one we have in the box is an interesting one. And please put your hand up or jump in if you want as a panelist to answer it. It was directed at Omnia, so I'll start with you. But that is, let me think. Do you think that all governments have the ability to make the effort and address climate change without harming their economies? So not all countries are the same as we go into this climate action. Omnia, how would you like to respond to that? And anyone else from our panel, if you put your hand up, I'll try and catch you.
Yes, this is a very important question because it's really important to understand that investing in climate change is a win-win solution. And for you to present to governments to act on climate change for health, there has to be the financial argument made. There are countries, for example, in the UK right now, their healthcare system is the first healthcare system in the world to try to commit to net zero carbon. And while they're doing that, it might seem to many countries, especially low middle income countries like myself in Egypt, that this is an investment, even though there is a huge return on investment when we are thinking about sustainable solutions for climate change and the financial gains to working on climate change. If we were to try to commit to net zero carbon or to use sustainable energy, at the end, the cost benefit and the outcome and the return on investment is going to be beneficial for economies, especially those that are in low middle income countries. So I think it's very important before asking governments to act on climate change for health, to have all the right arguments, especially the finances argument and the cost savings that these investments are going to bring, both for health, but also for the economy.
Thank you. Yeah, that's really important. I wonder if any other panelists want to come in on that point.
I could also come in on that, Alison. I think it is an important question because, I mean, sometimes we can be a bit simplistic from the climate change and the health side. And I think it's referred to in some of the other questions. We tell people, well, you should walk and cycle and everybody should use clean renewable energy and you know, we should all eat sustainably. And we have to recognize that some of this stuff does cost money up front. Even if it's better overall, even from early on, there will be winners and there will be losers. You know, part of the defense of coal, which is now almost indefensible on environmental or economic or health grounds, is coal workers, and there are jobs in the coal industry. And it's absolutely true. We do have to make sure that people who will lose out from some of these transitions, they need to be taken care of, and that is the job of government to say, well, here overall it's better to move in this direction. There will be losers. We need to make sure that we support those people who will lose out from these changes, because otherwise then they become a block on the changes. So I think that, as I say, the health benefits basically do tip the economics in most places to show that overall it is better for your economy and certainly better for the social welfare of your population to make these changes. But we also have to, you know, to make sure that's built into the way we design our policies and our financial incentives. Just one final point on this. I think that, for example, carbon taxes, there are now carbon taxes in many parts of the world. We know from some of the early experiences that it was a real problem trying to impose a carbon tax unless you made it revenue neutral and unless you showed that the money that you raised was going to go back into either into people's pockets or investing in things they were interested in. So I think we need to start with the broad vision and then design the economic policy to make sure that we compensate those people who will lose out from the changes.
Yeah, no, that's great. A real planned change. We know it's happening. We should go in eyes wide open and plan for it. That's fantastic. I have a very specific question for Lejane, which I think is really, in the climate sector, is going to be an increasing argument, you know, case that we have to make. And that's really about how do we get citizens to navigate the various different arguments for sustainable food consumption? Eat fish, don't eat fish, go vegan, don't go vegan. You know, it can get confusing. So how would you respond to that, Lejane?
Yeah, thanks. And that's a very good question, Carly. And yes, it is confusing for people and citizens regarding what to eat because of many confusing messages. The argument here is not just about what to eat, but also how is it produced. And what we're demanding for is like a flexitarian diet that's both healthy and sustainable with a reasonable amount. Of course, ultra-processed food, sugar-sweetened beverages is an exception, for example. One of the areas that we're looking at is building a sustainable and healthy food-based dietary guidelines that's setting the parameters and measures by the governments together with the stakeholders to design a diet that fits not just for the health and sustainability context of the country, but also for the culture and the cuisine of the country itself. In addition to that, it's not enough just to design such guidelines, but actually the implementation of it. For example, using a innovative labeling mechanisms to label such products when people goes to the food vendors, supermarkets to buy these products. A great example now, we have the Nutri-Score in France, where they have highlighted which of the products that's better of your health using a color coding system, green, yellow, and red. And adding sustainability element in that will help to inform people's choices the next time that they buy food, rather than being part of this ongoing circles and debates, what is healthy and what is sustainable, but having a combined approach about bottom up and top down as well to inform such choices, to make it easier and accessible for people to choose them in different areas.
Thank you. Really practical solutions there for that question. That's great. So there's a question in the box, which I know there's some discussion going on there, but I think we can raise it out loud. Well, I'll start with Alice. When I come to you, can you also let us know how we'll share the recording of this, if it's possible? That's a question to hold. But you have another question, which for you and Carly, which is, have you looked at the issue of personal safety, street lighting, other aspects in relation to active mobility? So it's one thing to say doing it, but there are a lot of considerations in that space. So Alice and then Carly.
Yes, I think that's a really interesting question, because just now I was just saying that walking and cycling was proven to be the most resilient modes of transport in the pandemic, but at the same time pedestrians and cyclists remain the most at risk in road environments. So which means that it really need additional investments in safer infrastructure, in these additional measures, and not just streetlights but also cameras, and also gender sensitive facilities, for example in metro systems. The one that I live very close with, they have women, they call it women's safe area during the nighttime, which have specific cameras and staff looking at that particular space so that you would feel comfortable waiting for the train over there. So it's very important to involve particularly vulnerable users groups in the designing and planning of these facilities, in order to really understand what the schedule and the planning and the location of these facilities are, in order to maximize or protect individuals from violence and from potential crimes and danger.
Carly,
should I comment on the recording? Sorry.
We'll come to that at the end. Let's
Okay.
just do that separately. Carly, you mentioned the gender aspect of that.
Yeah.
Example there.
Yeah, so I've mentioned it in the chat because I'm aware of the time, but the thing that I wanted to add is I feel like sometimes everyone expects the transport industry to kind of deal with all of the problems of the world. So, you know, there's this example quite in some Asian cities where they have, and Latin America, where they're having carriages separately for women. And I think we could have a whole workshop on whether that's a good idea or not. But I think sometimes there are so many fundamental issues in a society, and we're trying to put transport is like the plaster that we're trying to fix it with. But actually it can only do so much in the industry, but there are some underlying issues around kind of gender roles and sexual harassment and how women are viewed in society, how youth are viewed in society. And until those fundamental issues can get fixed, which is a very long-term issue, transport will only ever be able to be the plaster trying to hold things together.
Great, thank you. I'm going to squeeze in one personal question to Julie, actually, before we wrap up. And that's really, I've worked in climate change for a long time and talked about adaptation, but actually the health side is never to the fore. Do you think more could be done to get the medical responses front and centre to that adaptation resilience discussions at the COP26 this year and another global fora to really bring the urgency of health responses there?
Yeah, I think that's a really great question. And I think that even just looking across the huge variety of topics on this panel, it really collectively underscores the importance of raising this issue more in these policy spheres, as well as in the, the various other aspects of community resilience, et cetera, because they are such large, cross-cutting and intersecting topics. And so, yeah, I would say I think more should be done in terms of very practical ways to do that. I think it's a tough question, but I think maybe even increasing the storytelling of some of these practical experiences is one way to start off the top of my head. And I'm sure there's a lot more that could be done as well, but that's one idea that I would raise out there. And that's the storytelling of whether, medical professionals, students, the various, perspectives that we've heard here, and then also, of course, that local community level perspective as well, and trying to elevate those experiences and stories in these conversations too.
I think you're absolutely right. People don't know. I think awareness raising, getting this message out there that getting health right in these different spaces, and I think in the disaster response can really make a huge difference in terms of the outcome. So I think that's hopefully what the Health and Climate Network and many of the organisations represented here will continue to do over this year and for time to come. So we are going to answer that question about, so we've recorded this this Zoom call. Hopefully we can get it further. Alice, you're from SOCAT's managing that side of things. Can you just comment on how we might do that?
I would just say that I would be happy to share the recording if it's fine with all of us speakers, but we'll be able to follow up with an email to the participants and to share.
So we'll follow through with an email. Yeah. We've collected through your registration, so we'll get it out to you and do share it onwards. Because I think it's been a fascinating panel. It has been wide-ranging, but really that focus on health and climate, I think it just illustrates, as Julie just said, just how important it is to get those two things right and together, and to get health right in front and centre. It is so easy to plan for those win-wins if you're going to be making those decisions. Not so easy, that's wrong. The two go hand in hand is what I'm saying, that they shouldn't be separated. So you can get it right by making those right choices at global, national and local level. So I really want to thank the panel. I'm sure you'll thank them in the chat box or whatever way you do on Zoom calls. But thanks to everyone. We'll follow through with that email, and yeah, I think we'll close it there. Thank you very much.